Hello, if you've just joined us, you're watching Consider This. I'm Melisa Idris, with me, Sharaad Kuttan. Last week, the International Red Cross warned of rising suicides as a result of pressure and isolation. Now, it called for increased psychological support as part of the fight against the COVID-19 pandemic. While providing mental health support may not necessarily be very high on the agenda as we continue to contain the virus, but it is still an important issue that impacts millions of people. Now, joining us on the line is Ardy Ayadali, Publicity Director for Befrienders KL, which offers emotional support to those who are distressed, feeling depressed or suicidal. Ardy, good evening. Thank you for coming on the show tonight. Now, has Befrienders KL seen an increase in the number of calls during this MCO?
Thank you. So there was an increase during the first phase of MCO where during that time you still operate at our center in PJ with our usual hotlines. So the first 7 days see an increase of 13% in the number of calls. But what is alarming is the drastic increase in the number of calls related to COVID-19 and MCO. The first week was around 9%, and by second week it went up to 14%. And in the month of April so far, calls relating to COVID-19 and MCO has increased to up to 38%. So it seems that the longer it goes, there's more and more people who are finding it difficult to cope.
Could you tell us, Ardy, exactly what is it that they talk to you about? I mean, what are they concerned about? What would they like changed about their situation? Where's the stress coming from in terms of the MCO?
All right, okay. So the biggest challenge has always been on the mental health issues. Being in isolation increases the fear and hopelessness that they feel. And this can also lead to anxiety and depression. Apart from that, when someone is being isolated in a crowded family or space, the environment can also get toxic. So in some instances, there were reported cases of physical and even sexual abuse. And then there's also financial issues, those who can't earn because of MCO, and those who are running businesses who can't run but still have overhead to cover. So those are mainly the issues.
Well, can I ask, who's calling in? Do you know, I mean, in terms of a breakdown of what kind of demographic we're looking at, where they are? Is this predominantly urban areas that are calling in that have reached out to Befrienders? Do you know who's calling in?
We don't really know, but it's from the urban area.
Okay, and Ardy, what exactly do you advise your healthcare professionals who are, taking these calls? What do they say to people who are feeling despondent, or they're in toxic relationships, or they're concerned about the future of their business? What exactly could you say to them that will reassure them?
Okay, so it's actually really important to, first of all, to listen to them non-judgmentally, because that's what we do we provide emotional support to them. So by providing them this safe space where they can ventilate and talk about whatever that's on their mind, it actually helps in a sense, because you have to remember when they are in isolation, they can't go out to meet their friends or family or other family members or even counselors. So reaching out to someone who can actually empathize with their situation can actually help.
All right. And, you mentioned a bit earlier, Ardy, that these are the people who are finding it very difficult to cope in this period of MCO. I'm wondering about, how people can help. So how people in family members living in a home, or perhaps neighbors or friends, can reach out to help.
Okay, I think it all comes down to kindness, because we need a lot of kindness in tough situation like this, because even one small act of kindness can make a huge difference to people who are suffering throughout this difficult period of time.
Are you concerned that perhaps there's a significant portion of the community that's not reaching out for help, Ardy?
Oh, yeah, for sure, definitely. We are actually very concerned because, as I've mentioned, help is available, but like, for example, for Befrienders KL, we have changed the way that we are reachable because we have changed our number, and also we are also reachable through Skype nowadays. But unfortunately, because it's the short period of time to actually advertise the number, it takes time. So we don't get that many calls as we used to get compared to when we were running our hotline. So I believe there are a lot of people out there who are still clueless about where to seek help.
Okay. All right. Well, thank you. And thank you for speaking with us and also for the good work that you're doing. If you are feeling distressed or anxiety, please reach out to the Befrienders KL. They are just a quick Google search away for the new number. Now, we're going to continue this conversation, but joining us on the line now, we have Chan Wen Lee, Assistant Professor at the Faculty of Social Sciences at the University of Nottingham, Malaysia. Good evening. Welcome to the show. Now, as I understand it, you've researched suicide prevention through safe reporting practices, Wen Lee. Now, can you help, how has that previous research helped you understand the effects of the current COVID crisis on one's mental health?
Well, this is partly about the influence on media on our mental health, and it's well established in research that mass media has an effect on, expectations actually of our people around us and expectations of ourselves, almost indicating perceived standards for our way of life. And the media is powerful because it not only reflects public attitudes, but it also shapes them. And one important
aspect of suicide prevention is how information on mental health and indeed suicide prevention itself is disseminated on mass media. And in the area of interdisciplinary research that I do together with media academics and mental health practitioners is on the impact of media reports on suicide and why it's important that this is done in a safe manner. Now, it is rather worrying that there have already been reports of suicide taking place during this period. And this is where an important point needs to be made, which is that news reports on suicide can have the propensity to harm vulnerable persons. So by vulnerable persons, we're referring to persons who have lived experience of mental health conditions, which means they're more susceptible to attempts of suicide. Also persons who have been bereaved by suicide in the past.
Can I just get you to elaborate very quickly what you meant by safe practices? What do you mean by reporting on suicide in a safe manner?
Okay. Now, researchers studying what is termed copycat suicide behavior, right, or imitative suicide behavior, or a phenomenon also referred to as suicide contagion, have found that reports that sensationalize suicide, that show photos and details of the deceased, which have explicit references to the method of suicide and where the coverage is repeated on social media, on television and radio, those are examples of unsafe practices, and they're associated with imitative suicide behavior. And how it happens is loosely based on social learning theory, learning through observation. Now, on the flip side of that, researchers have also found that there is a potential protective effect of safe reporting, where if a story concentrates on positive coping aspects and help-seeking and how this has helped a person who has had thoughts of suicide before, how it has helped them get out of that, it contributes to the prevention of suicide. And there is a term that researchers have come up for this, which is the Papageno effect. Papageno is the name of a character in Mozart's opera, The Magic Flute. He's a well-loved character. He's a bird catcher. And in the opera, he falls into despair, and at one point of time, he contemplates suicide, but he abandons the thought of suicide when he's shown by other characters of alternatives out of the situation that he was in. Yeah.
But
so that's the Papageno effect.
Right, well, this is Sharaad here. Is the problem just about news reports on suicide, or just the news in general? I mean, it's depressing enough to read, endlessly, as most of us are doing, about the phenomena. Hundreds, thousands of people dying, videos of mass burials. I mean, is that enough? I mean, to actually lead somebody into depression or into taking extreme physical harm against themselves. I mean, what would your advice be about that?
Well, so we were talking about suicide earlier on, so it's quite important for viewers to know that the causes of suicide are complex, and there is often no way to determine the exact causes of a particular person's suicide. It may never be known, and it doesn't have to be known, because what's more important is to stop it from being imitated by others. So in the context of the current pandemic, the World Health Organization, the WHO, has indeed recommended that because of the impact of reading reports about people dying, etc., this information is continuously being streamed on social media and news sites, and it can lead to psychological reactions. And WHO actually recommends that you don't check. You can put down that handphone for a while and just check for news, just twice a day, 2 designated times a day, to minimize watching, reading, listening to news on COVID-19 that causes stress, anxiety, and of course, quite importantly, to seek information only from trusted sources.
So to stop that scrolling and perhaps just check in at designated points during the day.
Absolutely.
Very quickly,
10 p.m. I'll consider this, yes.
Very quickly, Wenli, I want to know, we spoke to the Befrienders KL just before we called into you. Where else would you recommend seeking help and support if you're feeling despondent and distressed with the current news cycle?
Well, the Befrienders are certainly a good resource. The Talian Cafe has counselors on duty, so they can be contacted as well. And there are also resources, for example, Mercy Malaysia via the Ministry of Health. And I believe the information is on the Ministry of Health's relevant websites. And Befrienders phone number is accessible throughout Malaysia. And there are other organizations such as Lifeline organization, and certain others, which some of these cater to Malay speakers, to Mandarin language speakers, and they don't just cater to English language speakers. And a good reference point would be official sources such as the MOH pages. And I do know of a site that my co-researchers, mental health practitioners, manage, which provides information in both English and Bahasa. It's called Laman Minda, one of many sources that are out there that provide useful information on how to manage one's mental health during this difficult situation.
Well, thank you so much for speaking with us tonight and sharing those leads with us, in case we want to find out more about getting help. Now, we're going to take a quick break, but after this, more on mental health in just a few minutes. Stay tuned to Consider This.